Hi, good morning, everyone, and welcome to our information session on Medicaid health plan changes and auto assignment. Our session today is being co-hosted by the Pennsylvania Health Law Project and the Pennsylvania Health Access Network. And we are delighted to see so many of you joining us here today. We have a wonderful panel of experts here today to discuss the upcoming changes to the Medicaid health plan changes in Pennsylvania, including a focus on what to do if you've been auto assigned to a new plan. And I'm going to introduce those panelists in a moment. Before we get started, I would like to go over some brief housekeeping notes just to make sure the session runs as smoothly as possible today. First, please remain on mute when you're not speaking. I'll do my best to keep an eye on microphones and make sure everyone's muted so there's no background noise. Live captioning or closed captioning is available for today's session. The icon to enable the captions is in the control panel at the bottom of your Zoom screen. You just click the icon that says CC Live Transcript and then click Enable Live Transcription. And if you want to hide the subtitles, you click on that again and click Hide or Show Subtitles. We are live streaming currently to Facebook, and we are recording as well, and we're going to be posting this session on our YouTube channel tomorrow. Today's session will include a round of questions, which I'm going to ask our panelists, and then as time permits at the end, we're going to take questions from the audience. So questions for the panelists should be submitted through the webinar Q&A panel at the bottom of your Zoom screen. Please don't submit questions through the chat, as with more people joining, it might just get flooded with questions. It's easier to answer the questions for the panelists if they're in the Q&A box at the bottom. And we're going to get to as many questions as possible today, but we do want to honor everyone's time. So we're committed to ending today by 11:30. So with that, I'm going to stop sharing my screen so that you can see our wonderful panelists. If Zoom will let me do that, there we go. And I'm going to introduce our panelists for today. So first we have Barry Bowman, Operations Chief and Director of Compliance with the Department of Human Services, Office of Medical Assistance Programs, Bureau of Managed Care Operations. We have Kyle Fisher, Managing Attorney with the Pennsylvania Health Law Project. We have Joanna Rosenheim, Consumer Engagement Manager with the Pennsylvania Health Access Network. Teresa McDonald, Outreach Operations Manager with PA Enrollment Services. And finally, we have Laura McMurray, PA EAP Project Manager with PA Enrollment Services. So with that, we will go ahead and dive right into the questions for today. And our first question is geared towards DHS. So Barry, this one will be for you. First, can you tell us why were certain consumers auto-assigned to a new plan? And when you answer that, can you say approximately how many people were auto-assigned of the nearly 500,000 that needed to choose a new plan?
Sure, thank you, Dana. Good morning, everybody. So auto assignment was a result of, if folks aren't aware of this, DHS reprocured the HealthChoices physical health program, and through that reprocurement, some changes resulted in the MCOs that are covering beneficiary lives across the Commonwealth. So there was a pool of beneficiaries that were in MCOs that would no longer be providing services after the September 1st implementation date. Those folks needed to choose a new MCO. They had a deadline of August 16th to choose a new MCO. If they had not chosen by that point, they were then placed into what we call the auto assignment pool, and that is where DHS takes those individuals and then they sort of evenly distribute them among the MCOs that are available in each operational zone throughout the Commonwealth. So that is sort of a high level overview of why folks were reassigned and who those folks are. But within that pool of auto assignment beneficiaries, there were about 370,000 people.
370,000, thank you. And how will those 370,000 people who were auto-assigned find out that they've been auto-assigned to a new plan?
So it's likely the earliest notification they will receive will be from the MCO that gained them into their member population. So the MCOs that gained new beneficiaries will be identifying those individuals and sending out a new member packet from the MCO that will go out to those beneficiaries. So as that comes in the mail, that's probably be one of the earlier ways that they will find out that they're in a new MCO. Within that packet, you'll see things, a welcome letter explaining who the plan is, that sort of thing. If a link to their online member handbook, or if they want a hard copy, they can request it. Things like that will be in the packet. There will also be potential telephonic outreach from MCOs regarding PCP selections. Many of the MCOs have processes where if somebody comes to the plan new and they haven't selected a PCP, they have 14 days really to get those folks to make a selection. And if not, they will need to assign a PCP. A lot of the MCOs try to do a certain level of outreach to folks who haven't selected a PCP. So some of them do that telephonically. The situation we're facing here is this is a large number of folks. So as the MCOs work through that large population, those telephonic type outreaches might be prolonged throughout the month of September into October.
Okay, just to follow up on that, Barry, and just a few more questions for you, and we'll move on to some other folks too. Besides the outreach regarding the primary care physician selection, is there any other proactive telephonic outreach by the plans to new members?
Yeah, so within the MCO's agreement to provide services with the Commonwealth, there's a provision that makes them responsible to outreach to new members to conduct what is essentially a new member assessment. It's a discussion of sort of clinical needs folks might have, things like that they do within these assessment. The requirement for that is they should do these within 90 days of enrollment. I think that in normal times when the plans are only getting us, say, a small number of new beneficiaries per month, the 90 day is easily achieved for them. And I think those assessments take place much earlier than that. So the MCOs will be working through this new population. So it may take an amount of time the MCOs need to conduct those outreaches and have as many of them be successful as possible. So they will probably need the full 90 days for that. So it's difficult to say when exactly that will happen as they work through the queue of these new members. But yes, they will be making those outreach attempts throughout that period for everybody that's newly enrolled in their MCOs.
Okay. And Barry, last question for you for now. You mentioned the welcome packets that folks will get from their new insurance plan, which will contain the member ID card and other things. How long will it take for consumers to get that in the mail?
So the MCOs, as they process their new member files that are sent to them by DHS, will be internally incorporating them into their IT systems, and then they go out to whatever vendors they might utilize to get their new member packages out. So depending on where you appear as a new member within that queue, you could start seeing new member packages as early as within the first week of September, and then probably throughout the period of September to early October, those packages will be going out.
Great. Next question is going to be for PA Enrollment Services. So either Teresa or Laura. If someone is supposed to change plans coming on September 1st, but they have not heard from their new plan yet, what should they do?
Thank you, Dana. I just want to reiterate, individuals should be receiving their welcome packet and member ID card from their new plan. So they started going out late August. So they should be looking for it early September into mid-September. But if they haven't received the information, they can check what health plans they have by logging into our mobile app, which is PA Enrollment Services, or logging into our website at www.enrollnow.net. The phone numbers for the plans are listed on both, so they're able to contact the plans once they see what plans they were assigned to. And If they aren't able to find the information, they can also call us at PA Enrollment Services at 1-800-440-3989. And our TTY line is 1-800-618-4225. They can select option 1 to access our self-service portal to see which plans they were assigned to and to get the contact information for those plans.
Great. And we're going to have a slide just so folks on the webinar know. Towards the end, I'll put a slide up that shows all the contact information that Terry just went over. So thank you, Teresa. Next question is for the Health Law Project. So Kyle, I wonder if you can answer this. How can individuals access their healthcare in the meantime before their new card arrives in the mail?
It's a good question, Dan, and I think this is a key point. Lots of folks, and I think Barry mentioned the number 370,000, which is news to me, right? I think some of us are learning things. A lot of this is happening as we speak, are going to be losing their current managed care plan effective tomorrow, right? September 1st. Those individuals are not losing their Medicaid coverage. And that's an important distinction, right? They will still have the ability to access services. Providers who treat them should still have the ability to be made whole, right? Have those services covered. Even if somebody doesn't understand, how do I now get my benefits? What managed care plan am I in now, right? Their underlying Medicaid is still intact. So how do they access services? If it's any sort of emergency scenario, they should call 911, go to the emergency room, do whatever they otherwise would have done to access services. If it's not an emergency scenario, then we're getting back to what I think Teresa described a second ago. They can find out which plan they're in by contacting PA Enrollment Services, either through its online website, its mobile portal, or calling them. They can also, if they have an already existing relationship with a doctor or another provider, contact their doctor's office. Right? So their provider's office should be able to confirm through the Promise Claim System or EBS that this person, Kyle, is still active in Medicaid and he's now enrolled in Plan ABC instead of Aetna or Gateway or United, right? Highmark, excuse me. If they don't have that pre-existing relationship with the provider, if they're accessing services for the first time, I think they really should reach out to that new managed care plan and see which doctors are in network. I need to select a PCP and access care that way. If they already have that existing relationship, go back to your normal doctor. They should be able to verify which plan you're in now. And then the question is that provider in network with your new managed care plan? If so, there shouldn't be any problems. If not, it's a bit more complicated. And this is going to get into the continuity protections we'll talk about in a few minutes here in more detail. So those providers should still be covered for services with some caveats that I think we'll get into. Put a pin in that one for now.
Thank you, Kyle. And we did get a question from the audience that I think flows well with the question you just answered. How do you find your member ID number?
I'm going to defer on that one to Enrollment Services. So member ID information, is that something you'd be able to provide to individuals contacting you?
Hi, so normally if someone is looking for their access card ID number, we always refer them to the Customer Services Center. So they should be able to help them with that information. I do not know the number off the top of my head, but we can get that and provide that as well.
It was the managed care MCO member ID number. Is that something that would?
So if someone's looking
available
for
to
their
you?
health plan, like their MCO health plan ID number, they would need to reach out to the MCO Member Services Department to get that information. If they're looking for their access card ID number, then they would want to touch base with the Customer Service Center.
Yes, and I can provide the information for the Customer Service Center.
Thank
So
you.
the phone number is 1-877-395-8930. And if you reside in Philadelphia, the number is 215-560-7226.
Thank you, Teresa. If you can, would you maybe just put that in the chat for folks so they can have that as reference? I don't believe we have that on our slide that we're going to put up.
Sure, absolutely.
Thank you so much. And while you're doing that, the next question is also for PA Enrollment Services. So if someone is unhappy with the plan that they've chosen, are they able to change plans?
Mhm. Yes,
And-
absolutely. So yes, they can make a plan transfer at any time. And Terry had mentioned a little earlier about the tools that are available. So they can go online to our website, which is www.enrollnow.net. They can also use our mobile app, which is PA Enrollment Services. And they can call us at any time. We're available Monday through Friday, 8 a.m. to 6 p.m. And we're available at 1-800-440-3989 and select option 6, and they'll be able to speak with a representative.
Wonderful. Thank you, Laura. My next question is for DHS. So Barry, what is the deadline to make a plan change to be effective October 1st? If somebody's in that situation where they've been auto-assigned and they decide they want a different plan.
Okay, thanks, Dana. So to be effective in a new MCO on October 1st, folks would need to contact the enrollment assistance contractor and make a selection by September 8th. That will be a deadline for entering an MCO change for the October 1st start date. So if they called, say after that, September 9th through October 13th, that would result in a November 1st start date.
Okay, great. And for months after October and November, Barry, are those plan choice timing rules going to be the same? Can you kind of walk through what the general cutoff is each month?
Sure. And it's not like a specific, it's not like a date, a consistent date on the calendar. So it's not the 8th of every month. So the way the dating rules are, and these are set up pre-annual every year by the department's IT systems. The dating rules, the easiest way to think about the dating rules are they are the second Thursday that falls within the month. So the reason it seems earlier in September is the first Thursday of September. The first actually falls on a Thursday in September. So then that makes the 8th the second Thursday. So if you want to think of it in terms of throughout the rest of the year, then the MCO transfer deadline to obtain a start date for the first of the next month falls on the second Thursday. So for example, the October 1st start date has a deadline of September 8th. The November 1st start date has a deadline of October 13th. And then subsequently, the December 1st start date would have a deadline of November 10th. So it would always be the second Thursday of the prior month if you want to start in that MCO the first of the following month.
Okay, and Barry, next question is, what if a member has an urgent healthcare need and they need to change plans sooner than October 1st? Is that possible to do?
Yeah, that's what we would call an expedited disenrollment or a retro enrollment into a new plan based upon a clinical need. And that it's a highly manual process. It's not something that we're able to automate because it's a unique situation. So those cases get looked at on a case by case sort of manner, and the approval of those is really based on clinical need. So they can, in fact, request an expedited disenrollment or a retro disenrollment, but it will be based on the clinical need. And generally, the approvals are reserved for serious clinical situations. You may run into situations where folks have a surgical or other procedure of that nature that had already been arranged, and for whatever reason, the provider just can't work with the new MCO, and they need to work with another MCO. Those would be situations where, there would be approval. We have folks, say pregnant women who are seeing an OBGYN and they've been seeing them throughout their pregnancy, and, similar situation if the provider for just can't work with the gaining MCO, needs to have another MCO, that would be a situation. Folks in ongoing serious treatments, folks under cancer care or hemophilia care, things like that. So it's a situation that if you really feel that this is going to be a problem, you can request that. And then what happens is that gets forwarded to my team. And we have a process for looking at those, approving them, and then working with our IT systems, because a lot of manual work has to take place to then reconvert them to a new MCO. Mm-hmm.
And Barry, I'm sorry if you said this, but I just want to make it clear for the audience. How exactly does somebody request the expedited enrollment? Like, where do they call? What do they do?
So I think they have a couple of means of getting to us with one of those. Certainly, we've seen them come through Maximus, and I think Laura and Teresa can agree with that. Folks may, if they didn't know where else to go and they call Maximus and explain the situation, Maximus actually has a process for getting them to us through our Maximus oversight folks. They could actually call the MCO to whom they've been assigned. That MCO then, the MCOs get these situations periodically just in the normal course of business. They then have a process to work with my staff to identify that and then bring in the new plan as necessary. In what we found in some of these cases, it doesn't the disenrollment doesn't necessarily need to take place, because upon consultation with the gaining MCO and speaking with the provider actually agrees to do a single case agreement or whatever it might need to be done for the period that they'll be in the gaining plan. But probably if they're really concerned and they don't know where else to go, Maximus is a good location. Always they can go to their MCO, their gaining MCO, even if they don't intend to stay with them. Once you're in them, they're prepared to help you with a number of situations, and this is a situation that they can help you with. And then also, I'll probably have to give you the link to this to maybe provide after. There's something called a managed care directory. It's on the DHS website. It's under managed care information. It's one of the toggles under managed care information. It's called a managed care directory. Within that, it identifies all the MCOs that are in the program, the HealthChoices program, but it also has a block on there that identifies the contract team manager at DHS for each of those MCOs. And within that, there's a telephonic as well as an email contact. So if folks find themselves in that situation and maybe they have access to the internet and they can access that, identify the plan that they're in, the contract team manager at DHS, and make contact directly with the contract team manager. And then we have a process for this, and we can help them through it. So there's three measures. And obviously these get sent to us. Folks that may not know where to go. I mean, we could actually see these come from I don't recommend that people go to legislative offices with these types of problems, because it just sort of prolongs the situation. They have to contact DHS, legislative affairs, and all that sort of thing. But that is a venue as well, whatever they're comfortable with, or stakeholder organizations that work with us, such as PHLP, or maybe some fan folks here or whatever. If folks approach you, you can always contact us as well. Mm-hmm.
Okay. I will, after the webinar, send out that the managed care directory that you mentioned, Barry, and I'm also going to send the slides that we are putting up today, just so folks in the audience are aware. And Barry, can you clarify, when you say Maximus, is that the same thing as PA Enrollment Services?
Yeah, I'm sorry, that's their business name, but they do business in Pennsylvania for us as Pennsylvania Enrollment. So it is the same folks. Yes.
Okay, thank you very much. The next question is for the Health Access Network. So Joanna, what kinds of things should someone consider when they're deciding to change plans?
Yeah, so when folks are changing plans, the main thing to consider is what plans do your doctors accept. So you want to find out which plans your doctors are in network with. And then if not all of your doctors accept the same plan, you definitely want to consider which doctors you might have to change to, because that's a possibility that you might have to change your doctors, or which plan you might want to change to, depending on the situation. So some things to keep in mind, you might have to change some of your doctors if they are not all accepted by your new plan. And if not all of your doctors are accepted by the new plan, you'll want to look into what doctors are accepted with the plan and switch as soon as possible to make sure that you can receive care without any interruptions. Alternatively, you can also check to see if there are any plans that cover most or all of your doctors if your current plan that you're assigned to does not. And then something else to keep in mind too is that if there are multiple family members in the households, you may choose different plans for each member. So not every family member in the household has to have the same plan. So those are kind of the main things to keep in mind.
Thank you. Our next question, we go back to Barry from DHS. The plan changes that we're talking about, just to sort of level set for folks, do these apply to the Community Health Choices program, to the CHIP program, or to behavioral health plans?
Thanks, Dana. I think that's a really good question. So just, I want to be really clear on this matter. These changes only apply to the Physical Health Choices program. And I know that can be confusing because of the use of the term health choices within a couple of different delivery systems for Medicaid benefits. This is Physical Health Choices, and just if you want to think of it in terms, these are the services that you obtain through, say, primary care and hospitals and dentists and things like that. These changes do not apply to the Behavioral Health Choices program, nor do they apply to the Community Health Choices long-term supports and services program. And they also do not apply to the Children's Health Insurance Program, also known as CHIP. So these changes apply exclusively to the Health Choices Physical Health Program.
Okay, thank you, Barry. The next question is for the Health Thought Project. So Kyle, do all these changes impact the Medicaid benefits that are available to folks?
General, no. Excuse me. So the main benefit package is set by the state and it's standardized across the plan. So whether someone has the child benefit package or the adult package, that's not going to change, and the core benefits available don't change either. And really credit back to Governor Wolf implementing these sort of standardized, simplified benefit packages at the beginning of his tenure. Where there's an exception to that rule is for certain sort of extra or value added benefits that the plans can offer. So you'll see, for instance, some managed care plans might offer a gym membership or eyeglasses or a pregnancy incentive bundle. So sort of peripheral benefits in some ways, where there are some differences between the plans. And that's really the only place where the benefits available would differ between the managed care plans.
And a follow-up question for that, to that one, Kyle, is does it change the healthcare costs that somebody would incur?
There too, no, with some fairly minor exceptions. So the co-pays or cost sharing for Medicaid are set by federal statute to be nominal. So the state sort of has its own sort of desk reference, its own co-pay set amounts, and the plans have the discretion to waive those co-payments or to reduce what they charge their members, but they can't increase them. So we see, for instance, that some of the managed care plans charge a $2 copay for durable medical equipment purchases. Right, I think it's very common to see $1 copays for generic medications, $3 for brand name. So the only situation where someone would see a difference in the copays they have to pay, or if they're moving from a plan that waived or reduced a copay to one that does not. So they may be going from a situation where they had no copay to having to pay $1 or $2 or something along those lines. The list of what plans charge which copays for particular services is on, shameless plug, on the PA Enrollment Services website here. If you look at compare plans, is that right, Laura, Teresa?
Yes, Kyle. And also if they look at program resources, if you go under program resources, you can put your county in which you reside. So you're able to pull up the comparison chart as well as other information specifically related to that county, behavioral health, medical assistance, transportation program.
Great, thank you both. Joanna, next question is for you. Can people continue to see the same doctors and other healthcare providers under their new health plan when they switch?
Right. So as I mentioned earlier, folks might have to change their plans or providers depending on the situation. So you want to make sure that you're checking before you make any changes to see if your doctors are still in network. But if they are not in network, you can still be seen under a couple of exceptions. So if the provider is not currently a participant in the new plan, they can kind of agree to be, basically billed for the in-network Medicaid rate if they're willing. But this would require, some extra paperwork and red tape, but it can be done. The other exception is if folks have ongoing courses of treatment. So if the person has any scheduled appointments after the HealthChoices transition, they can still see their providers that they had for any follow-up appointments that were already scheduled and that were related to ongoing care. So things for example, cancer treatment. If folks were being treated for cancer and they had follow-up appointments scheduled, those appointments should still be honored under the new plan. If there's anything I'm missing, please let me know, but those are the exceptions that I know of.
I would just add to Joanna's point that temporary continuity right typically ends at 60 days. So 60 days or until the receiving plan and the gaining plan has done its own concurrent review. So generally it's going to be temporary. And in that sort of buffer period, if you will, your treating provider may choose to become in network with the new plan or may agree to a single case agreement. I think Barry mentioned that before, to treat you on an ongoing basis, or you may need to change managed care plans to stay with that doc. But that then gets into the issue that Joanna highlighted, where if you're seeing multiple providers, it may not be possible to change into a plan that has them all.
Thank you, Joanna and Kyle. And Kyle, next question is for you, and it sort of relates. So how does somebody go about finding a new in-network doctor or other healthcare provider?
They can contact their managed care plan, and I think that's probably the simplest way or the cleanest way. So the plan that they're in now, the new plan, if they don't have a particular provider in mind, consult the provider directory, either on the plan's website or call them to ask, what types of cardiologists, say, do you have within a 5 or a 10-mile radius around you? That provider directors are also on the PA Enrollment Services website. And if a person has a particular provider in mind, they can reach out to that provider's office directly and ask which managed care plans. I'm in physical health, HealthChoices, which plans do you accept? And I think there are ways in which none of these alternatives are ideal. So occasionally the provider directories are not active, right? They'll list a provider, a person reaches out to them and they say, well, actually, I'm not accepting anymore. I'm not accepting that plan anymore, where I've reached my sort of panel limit. But the same thing can happen calling a doctor's office. You might get someone sort of frontline staff who's not aware that, in fact, they do take it. Managed care plan XYZ and touch you otherwise. So I think if you know the provider's office you want to go to, I would probably start there. But otherwise, I think use your managed care plan, use their provider directory, use their member services.
Thank you, Kyle. Joanna,
I'm sorry. I think one good addition to that is if you outreach directly to the MCO, maybe you have an interest in a provider, but you need some help with that. The MCO then has people who can help you with arranging appointments and contacting providers. So the MCO can actually be a good resource too. If you don't just want to, check a directory electronically, you can actually reach out to the MCO and then they can help you and they can do various types of provider outreach, and they can identify provider offices that might be good for you as well, because they have some abilities on their computers to look at geo-accessing and things from where you live. So an outreach to your MCO, regardless of how long you think you might be staying with them, is always a good thing too. They're there to help you.
Thank you, Barry. That's helpful additional information. The next question, Joanna, I think you touched on this briefly, but I just want to make it clear for folks. So can someone who is pregnant or otherwise in an ongoing, like in the middle of a course of treatment, continue seeing the same providers when they switch?
Yeah, so if someone's pregnant, then you can continue to see your OBGYN throughout the duration of the pregnancy and the postpartum period. In addition, children can also receive care for ongoing courses of treatment if they're under 21. But for other providers, as Kyle mentioned, there's a 60-day, buffer period where after that period for providers that aren't your OBGYN, you'll have to, either find a new doctor or switch plans.
Thank you. Back to Kyle for the next question. How will the plan change affect someone who is authorized for something like skilled nursing or home health aid services through their Medicaid plan?
So the continuity rules that we were just talking about apply to services as well as the ability to continue seeing certain providers. And so I think just to highlight or reiterate what Joanna described there. So for children receiving services, the receiving plan is supposed to honor that prior auth through the duration of the authorization period or into the end of the service if it's something that's not prior auth. For adults, the receiving plan has to honor the prior auth initially for up to 60 days or until it's done its own clinical review. And important to note there, so if I'm an adult getting a prior authorized service and the plan does their own review and denies that service or denies that service in part, then they're required to send the normal denial notices with appeal rights. And someone who appeals that denial timely, so within 10 days, is entitled to continue getting the service pending appeal.
Okay, and Kyle, there's a question in the audience that I think flows nicely with this one. Will services such as private duty nursing care resume without issues?
If I understand the question correctly, yes, I mean, that's part of the continuity, right? So if we're talking about private duty nursing, we're necessarily talking about children, right? It's a pediatric state plan benefit. So if that service period is in place when a person switches over, say, for example, I'm switching from Aetna to Health Partners, even if I am using a home health agency that is not in network with the receiving plan, Health Partners in this scenario, it has to continue paying for those services for the child, and because we're talking about a child, at least until the end of the existing authorization period. And at that point, as you would in any other circumstance, the child's providers and agencies should be submitting a new request before the end of that auth period ends.
And a follow-up question, Kyle, is there anything that the provider has to do for those private duty nursing services when they find out that their client or their patient has switched plans?
Yeah, well, certainly if the person has switched into a plan that the agency does not contract with, they're going to need to contact that plan and figure out what are their billing methods, what's the protocol for out-of-network providers to submit claims. So there's the obligation, there's a requirement we've been talking about. The new or the receiving MCO has to cover these claims where they're encompassed within the continuity protections, but the providers are going to have to go through the process of figuring out how does that happen.
Okay, thank you very much. And next question is for Barry from DHS. What should someone do if their new plan is not following these various continuity rules that were just discussed?
Okay, normally the realization of that would probably come from, say, the person's provider. So after speaking with your provider, that they don't believe this continuity coverage is being pursued by your gaining MCO, and it's always a good thing also to touch base with the MCO. But after speaking with the provider and the MCO, and you believe that they are not following the continuity of care, they can certainly contact my staff at the Bureau of Managed Care Operations, and that would be a similar contact point as I discussed earlier with the MCO directory. I would direct it to the contract manager that is listed in that directory for the MCO, the gaining MCO that you're currently in. You can certainly do that. I don't know that this is something normally the enrollment assistance program would hear about, but I suspect that if you guys at your special need, like they have a special needs folks too, if they got a call like that, they could certainly refer it to us. We could see referrals also from like if they come into your office, Dana, and explain this situation to you and stuff. And, you guys all have contacts with me and my staff as well. So I think there are various venues there, but if you really want to get directly to DHS contract staff, then certainly consult the directory, identify the contract manager, and you can reach out to them, at their direct contact information, and then we'll investigate the matter. We'll make contacts with both the losing and the gaining MCOs and potentially the provider as well. We'll obtain some information, regarding what's transpiring. We may contact the provider, and we'll then work on the situation and make sure that everybody is doing things that comport with the requirements for continuity of care in the agreement and according to medical assistance policy.
Okay, thank you, Barry. I'm going to turn now to questions from the audience, and I'm going to start with one that just sort of reiterates and follows up on the prior authorization rules that you talked about, Kyle, for nursing, or for any other prior authorized service. If it's just to confirm, the question says, if a child under 21 has a pre-authorization for a service, then that member has the entire length of the approval that was given with the old MCO. But if it were an adult, the time frame window is only 60 days, regardless of the original time frame from the old MCO. I think that is correct, but I want to turn to you, Kyle, to answer that.
Yeah, I think the only addition is for adults, it's up to 60 days or until the gaining managed care plan does its own concurrent review. So if the receiving plan is able to do its own prior authorization review before those 60 days have elapsed, the right is not to absolute 60 days for adults.
Okay, thank you. There's a comment that certain MCOs do not always maintain current provider lists, and they don't remove former providers or offices closed or doctors who have retired. Barry, can you just reiterate what someone can do in that situation? If, let's say, they call their MCO, they're given a doctor's name to call, and they call that doctor's office, and they no longer are actually in that MCO.
Yeah, so you see this periodically, and actually this can happen in the commercial realm as well. Sometimes there are obligations on the provider side if they've stopped deciding to see members of a certain insurer. Sometimes when they retire, or even if they pass away and things, they don't necessarily report that to all the insurers with whom they contract. So, I've seen this elsewhere as well. So if you're contacting the MCO directly and they're giving you a provider name, and then subsequent contact with that provider is telling you, well, I don't take that, you really should go back to the MCO, speak with them about the contradiction that you're hearing in that. And in some cases, it might actually be a mistake at the provider's office, depending on who's working the front office that day and how much training they have. They may actually be contracted with the MCO and not realize, or they may have more openings, appointment openings for medical assistant folks than they knew, those sorts of things. But give the MCO an opportunity to correct that. If you run into that sort of, and it continues on, then again, you can absolutely contact my staff, identified within the directory. If folks really were desperate for somewhere to go, Laura's people get all sorts of inquiries. If they would get an inquiry like that, not only could they maybe help identify alternative providers, but they could also refer it to our staff. They have direct communications with my management staff, so we can certainly help out in a situation as that as well. But I would give the MCO an opportunity to sort of correct the situation, and they may indeed be able to go to the provider that was saying that they can't see them for whatever reason once the MCO speaks with them.
Okay, great. Thank you, Barry. Kyle, I'm going to direct this question to you. It's about prior authorizations for medications and accessing meds at the pharmacy. What happens to a prior authorized approval for medication when the company, in this case Aetna, leaves the county? Are refills still supported for a window of time? Does a new appointment need to be made with the provider to request another authorization submittal? And what if the patient cannot get an appointment in the window of time the refill is covered and cannot acquire a medication from the pharmacy? And let me know if you need me to reiterate any portions of that question.
Compound questions there. I think that was like 4 questions, Dana. I don't know if I'm going to answer all
We're
those.
putting you to the test today, Kyle.
Yeah, and I don't want to speak out of turn. So I think the continuity rules here in the bulletin, if others want to look at this, it's bulletin 990313. It's a MA bulletin dating back to 2003 with a handful of attachments. I don't believe it speaks to refills, right? So the continuity rights really go to the existing prior authorized service or the existing ongoing course of treatment. In this question, we're talking about prior authorized medications for an adult. I think the rules are until a concurrent review happens or through 60 days. I don't see where any sort of medication refills would be encompassed by continuity. So I think that person's going to need to have their prescribing provider submit the new request to the plan. That's my take. Others on the panel may see this differently or have more to add.
Kyle, what about emergency supplies? Is that something that might be available to consumers?
Yeah, so even apart from any sort of plan change, there is an emergency supply provision that changes depending on whether this is a medication that was previously covered by the person's Medicaid. So if I go to the pharmacy and my request for a particular medication is denied, if it's already been a covered med, the emergency supply provision should kick in at the pharmacist's discretion. They can issue me either a 10 or a 15-day supply if it's been a previously covered med. So while I'm going through presumably an appeal process to try to get my insurance company to cover it. Now, that's apart from continuity. If it's a medication I haven't been receiving in the past, then there's still an emergency supply protection, but it's much more limited. And I'm blanking on whether it's 5-day supply or a 3-day supply. Others on the panel may know this, Joanna or Barry.
Boy, that's I think initially early in the program it was 72 hours, but I think most of the MCOs have defaulted to 5-day supplies.
Pop quiz here.
But in any event,
miserably.
yeah, in any event, there is an emergency supply available for a newly prescribed medication. Now, obviously, that then both of those instances sort of fall under the discretion of the pharmacist on safety and that sort of thing of what type of medication it could be. So, but normally, yes, the emergency supplies are available for both ongoing and new medications.
I should note there too, with a new prescription going in for a medication, the managed care plans are supposed to turn that around really quickly. Right? It's a 48-hour window, I believe, for a plan to issue a decision on that. And obviously, if they've denied a medication, the person has full appeal rights, including the right to expedite an appeal if they and their treating provider think the normal appeal timelines could jeopardize their health.
Thank you, Barry and Kyle. Joanna, I'll direct the next audience question to you. When the insurance changes and you have to change your doctors, what if the doctors that you are required to see are not accepting new patients? What do you do then?
So if you need to see, I'm sorry, could you post the question again?
Yeah, absolutely. So if you need to, when the insurance changes and you have to change doctors, what if the required doctors you need are not accepting new patients? Then what do you do?
Yeah, so sometimes we run into issues where someone is seeing a certain specialist and none of the specialists that they need to see are taking new patients. With that, none of the doctors that are in network with the plan are taking new patients. So we run into this fairly frequently. And there should be a process for the the MCOs to essentially ensure that if there aren't any doctors in the network seeing accepting new patients, that patients can see doctors that are out of network. So I don't know if DHS wants to clarify the process for that, but that's our understanding, that if there aren't any providers accepting new patients, that they should be able to see doctors out of network.
Yeah, and that's actually falls under their basically their certification to operate as an HMO by the Department of Pennsylvania Insurance Department. So if any MCO cannot cover the needed services within network, they have to allow out of network. So if there was another provider around there that that was available, they would have to allow out of network. Now, that said, when situations like this, always work with your MCO on that, because again, there are providers who might be indicating to somebody just making a random call that they don't have slots available or appointments available. Whereas when they're approached by the MCO directly, they may make concessions based on, well, I had seen other members of this family, or actually I can take this because they have access requirements within their provider agreement with the MCOs. And sometimes when they're saying things that don't comport with that, and the MCOs remind them of their provider contractual obligations, they then may have a sort of a different sense of what they will and what they won't accept. So always reaching out to your MCO with those types of problems is sort of the best first defense for those. And then if you really get yourself in a situation, then the MCO has to provide that service. They have to make that service available to you. And what they may end up having to do is, yes, offer an out-of-network provider or working with another provider who can indeed provide that services that were maybe unknown to everybody that was involved. So the MCO is there to troubleshoot those problems. They're under agreement with the Commonwealth to troubleshoot those problems. So go to the MCO.
And Barry, just a quick follow-up. When you say go to the MCO, does that mean call the health plan like member services line? Would the special needs unit be the best place to go?
Special need is self-defined in our program. So, it's really defined as, if I feel I have a special need, you could technically you have a special need. All the plans have special need units that are available to help with any number of things that people feel are a special need. But if you call the member services, they can direct whatever the inquiry is appropriately. If it's something that absolutely needs to go to utilization management, i.e. or case management, like nurses to help with certain conditions or whatever, that's where they'll go. Provider problems, what the member services folks might do is engage the provider network people who will do an outreach to the provider and remind them that under their contract with the MCO, they have to see their patients within a period of time, those sorts of things. So contact the member services. They'll sort of triage, what you're calling about, what your problem is, and then they will direct it appropriately. And again, if you feel that you're truly getting the runaround and they're just not providing the help that you think you need, and or the information has not been helpful in any way, you can certainly come to the department. And again, I'll refer people back to the director. You can go to the DHS contract manager for the plan that you're in, and we will certainly investigate the matter, because they are obligated to make sure those services are available. Why they're primarily in network, but if they need to go on network, they need to do that.
Thank
And
you,
I'll
Barry.
just add to that quickly. Yeah, it's best to stay on the line with the managed care organization too, and have them call with you to the providers. That way they can see that if you are having issues, if you tried to call through like 10, 20 providers and they're all not accepting new patients, then to just stay on the line with them, because often that will trigger a response as well.
That's a great point, Joanna. Thank you. And I'll note, when I send around the MCO directory document, it will have the member services number for each plan listed there. It's also listed on the back of the ID card that you'll get when you switch into the plan. All right. Next question, I'm going to turn to PA Enrollment Services. So if someone was 1 day late for the August 16th deadline, but they did successfully change the MCO, will that person still be auto assigned?
So yes, if the cutoff date was missed, then they would be auto assigned, and it depends on when they made that plan transfer. But I think the best way to just confirm that is to take a look at our website, so they can check to see when their plan starts, what plan they have. I think Kyle had mentioned it before, even reaching out to your doctor's office. They can check to see what plan you have. So they can call us as well if they need to select option 1 to self-serve. And then if they find that they were assigned and they need further assistance, they can reach out to us as well.
Great, thank you, Laura. I'm going to
Mhm.
share my screen for a moment so I can put up everyone's contact information while we continue on with the questions. Not that one, this one. So here's the phone numbers for the Health Access Network helpline, the helpline of the Pennsylvania Health Law Project, and the contact number for PA Enrollment Services. And again, I will be providing these slides, so you don't have to worry about writing down or memorizing these numbers. They're going to be emailed around to everybody no later than tomorrow. All right, start that share. Okay, the next question is more about the continuity rules. So either Kyle, I think, or Barry, I'll defer and see who wants to answer this one. If a member was seeing an in-network provider with the old MCO and that provider is out of network with the new MCO, regardless of the member's age, is the continuity timeframe for those scenarios 60 days as well? And the second part is it service specific? Example, will that scenario apply to members who need routine care, or is it just for members who need true continuity of care treatment?
Yeah, so that's a good question. I think there is some nuance here in how continuity applies. It is tied to the service. So when you're looking at whether a person had an ongoing course of treatment, whether, say, well care visits constitute ongoing course of treatment, I think looking back at how this is operationalized in the contracts does depend on whether the person is a child or an adult. So my recollection, and I think we'd have to scour the contract to be certain, unless someone else on the call knows this off the top of their head, is a child with a scheduled well child visit is encompassed within continuity, but that's not the case for adults. So I think as a general matter, right, the continuity period is going to be tied to the service or whatever the ongoing course of treatment was, rather than just tied to a particular provider outside of any treatment or ongoing services.
Okay. And Kyle, I mentioned the helpline of the Health Law Project. Might that person who asked the question or anyone else who has further questions be able to call the helpline? Can you just kind of walk through who?
Yeah, absolutely. So anybody having problems accessing services, starting tomorrow, when we have an 911 changeover, is welcome to call our helpline. That's the type of issue that we would be happy to help with. We don't do plan changes or enrollment issues. That would be PA Enrollment Services or FAN. But for somebody who's trying to access services and they're having a problem doing that with the new plan, please certainly reach out to us. And our helpline is open on Mondays and Wednesdays from 8 a.m. to 8 p.m.
Thank you. And before we go to the next question, Joanna, do you want to just do a short plug for your helpline at the Health Access Network?
Yeah, so we can also troubleshoot any issues. If you're seeing any issues, you can call us and we can try to help with that. But we also do application assistance. We can help make plan selections. Pretty much any issue that you're having, we can help with. But definitely, if you're looking to change plans or apply for coverage, we can do that as well.
Thanks, Joanna. And I will just add on that the services at the Health Law Project and the Health Access Network are completely free. So that's a wonderful resource for folks. And the last question I'm having up on my screen from the audience, I'm going to direct to Barry from DHS. This is from a provider's office. So if a patient does not know which MCO they are newly enrolled in, who do we bill for services provided as of 9/1?
So here's a reminder for medical assistance enrolled providers. As you're performing services, pretty much for any Medicaid beneficiary, you really should identify both their eligibility and their MCO of record within your EBS system. The EBS system will show you both that they are eligible and it will also indicate the MCO that they are currently enrolled in. If you discover that they are in an MCO with whom you don't contract and you want to and you want to schedule an appointment, you can reach out to that MCO to discuss a single case agreement if you're willing to do that, or if you're actually interested in joining their network. I know there's a certain percentage of providers who may want to join additional networks throughout this because MCOs are coming in that are doing business maybe differently than some of the predecessors have. So either way, an outreach to the MCO would be fine. If you should discuss also with the member to contact the MCO about the situation. So there's definitely alternatives on what to do there, but reaching out to the MCO of record is highly indicated.
Thank you, Barry. And one more just came in. I think this is sort of a comment, but it may be something that we can provide in the follow-up email that we send around. Please post phone numbers for doctors' offices to call these agencies to assist with patients who often have great difficulty in navigating healthcare services. The main numbers for customer service reps, I think that means member services, are not set up to assist the practitioners, confirm ROI for confidentiality, or to speak with family who try to help members who may have communication barriers talking over the phone. So Barry, maybe would it be appropriate to share on the MCO directory to direct those providers to the provider services lines? Okay.
Yeah.
Sorry, did you want to say something, Barry?
No, I was agreeing. Provider
Agreed.
services would be a good
Okay.
outreach.
Okay, great. So I'll make sure when I send around the slides and the MCO directory that the provider services phone number is there. And that's definitely a great resource for providers to call, because I think the comment is true that if a provider calls the member services line, I'm not so sure how far they would get unless maybe they had the member there with them in the room. All right. So I'm not seeing any more questions. I'm going to go ahead and post the phone numbers again, just so folks can have it. I want to thank all of our panelists today for joining. We're wrapping up a little bit early today. I think everyone did a wonderful job and answered some really tough questions. So thank you all for your time. Just as a reminder, there will be an email that goes around with the slides, with the MCO directory, and with the link to the recording of today's session as well. And you can also rewatch the recording of this session on Facebook Live. And as I'm wrapping up, I'm getting a few more questions. And so we're going to just go ahead with those. One person says, I'm going to direct this to Fan. Maybe you can tell them what to do. I haven't received any new application for a year. I think that means Medicaid application. Is that something you can speak to, Joanna?
Yeah, so I think you might be referring to the renewal packet. So you may be expecting to receive a renewal packet at this time of year. You can feel free to give us a call at our helpline and I can look up when your renewal date is. That way we can kind of figure out what's going on. And if you haven't gotten it when you were supposed to, then we can contact, the call center, the statewide call center, and see what's going on. But definitely feel free to give our helpline a call.
Right.
Yeah, and I think one point of important information there is that nobody has been losing Medicaid eligibility during the public health emergency as declared by the federal government. So that's currently running through October. So they wouldn't necessarily be processing recertification packages until after the public health emergency has been declared over by the federal government. At this point, we're not sure if the federal government is going to extend that again or not, but that might be part of the reason folks haven't necessarily been seeing regular recertification packages, because the public health emergency at the federal level continues, so folks on Medicaid are not losing eligibility.
That's a great point.
And just addition to that, it's still important for individuals to update their addresses, especially either on Compass or with their county assistance office, so that when they do get required paperwork, that they're actually able to get that from the CAO, and that they're not having their coverage stopped post PHE for procedural reasons.
Thank you.
Yeah, can I just add to that, Kyle? If someone calls the Enrollment Services Department and they do provide us with an updated phone number or address, we do refer them to the customer service center as well, so that they can make sure that they have that updated information. So yeah, thank you.
Thank you, everyone. That's helpful. Okay, next question for Barry at DHS. I wonder if you can answer this question from a provider. What if we as a provider are not contracted with the new MCO and the patients are linked to that plan? Will the MCO pay us for the visit?
I think that depends on the situation. Obviously, if it's a continuity sort of situation where somebody's in an ongoing course of treatment, I don't know what type of provider this is. So if it's something that falls within the continuity, yes, they are obligated, the new plan, to pay for that. If you're going to see somebody to authorize a new course of services, you really should be outreaching to the new gaining MCO, particularly obviously if it's something that requires prior authorization. But even to perform services for somebody who's new to an MCO that perhaps you hadn't seen them for an ongoing course of treatment, out of network services are normally a prior authorized aspect of an MCO's coverage. So you really should be outreaching to the gaining MCO to discuss coverage if you want to continue to see this individual, either through a single case agreement approval, if you just want to see this person, or if you're interested in joining the network. Either way, reaching out to the MCO is advisable in all those cases.
Kyle, I'll direct the next question to you. Has to do with the end of the public health emergency. October was mentioned. Was there any, the question was there any notification given of the 60 days to end the public health emergency, or will it be extended past October?
Yeah, good question. So it's referring to the commitment by the Biden administration at the federal level to provide states and other stakeholders with 60 days notice in advance before it allows the public health emergency to expire. The Biden administration did not provide that 60-day advance notice earlier this month. So I think the expectation is among many parties that it's going to extend the public health emergency at least one more time. So set to expire mid-October, as I believe Barry mentioned a minute ago. Another 90-day extension would take us through the middle of January. And so in terms of the continuous coverage protections tied to the Families First Coronavirus Protection Act, going back over 2 years now, states would have a period of time to review all those eligibility cases of the no MA closures, individuals who have been held on because of the public health emergency. States would be able to start reviewing those essentially effective February 1st if the and stopping those cases if the PHE isn't extended again past that middle of January date.
Okay. Thank you, Kyle. And I'm not getting any more questions. So unless they trickle in as I'm closing out here, I think we will wrap up. And again, I just want to thank all of our panelists from DHS, PA Enrollment Services, the Health Law Project, and the Health Access Network. I think this was a very informative session for folks, and Please do reach out to the various resources that we've mentioned throughout the presentation today. And the Health Law Project helpline is available, as well as the Health Access Network's helpline for consumers who need help troubleshooting. All right, so thank you, everyone, and enjoy the rest of your day.
Hey, Dana, thanks a lot.
Thank
Thank
you.
you.
Thank you.